The management of the Kanifing General Hospital last week announced the decision to convert the hospital into a COVID-19 treatment center. The move, according to the Director of Health Services, Dr. Mustafa Bitey, was prompted by the increased demand for beds for COVID-19 patients in the country. Gambia has recently joined African countries with the fastest growing number of COVID-19 cases according to the World Health Organization. The Ministry of Health, or the Minister of Health, Dr. Mamadou Lamin Samate, had some months ago announced the procurement of up to 2,000 hospital beds to specifically address a possible surge of the virus in the country. The Kanifing General Hospital is considered as the most sophisticated facility next to the country's main referral hospital in Banjul. However, Dr. Mustafa Bitey, the Director of Health Services at the Ministry of Health, told iAfrica TV on Monday that preparations are not completed for the hospital to accommodate COVID-19 patients.
Today's operations or activities, at the hospital, is the hospital fully ready to accommodate the COVID-19 patients as it's going to be transformed for a treatment center?
No, it's not. It's a process that they are going, so it's not yet operational. So they are looking at it. They've done a first preliminary report and they've sent it. As to other things they will need that will operationalize that. And they are also doing a lot of trainings, and then after that we can decide on how we go about it.
Now that, of course, we were told that, effective today, the hospital will be turned to a treatment center. And now, and also considering that the number of COVID-19 cases are increasing, how many patients can be treated at the hospital at the moment? Should everything be ready?
I think you need to clarify one thing, that, the information that was going around is not like what was in the press release from government. As far as it's just people who got some information out which were not supposed to be out. That's your internal memo. So it's not communicated this day it will start. We're just dealing internally to make sure that everything is fine before we come out to the public and all the operational issues are dealt with. So, yes, and they are going through that. They've had the experts look at it and look at all the options. It's not that right now we've run out of treatment centers or we don't have beds for patients. No, it's just a contingency. Because we know that we are going to a stage where we'll be having so many cases.
Yeah, but it's also part of your plan to change the hospital to a treatment center, like I say, it's a contingency plan, and also
exactly. Exactly, yeah. So it's a plan, and it's not like it has to be today exactly. So that was the plan to do that, So, but they've done reports, and we are looking at that, and there are a few things we need to put in place to ensure. And they are also recommending other things that we need to look at before we just embark on it.
At what level are you in terms of preparations? Like you say, it's not official, but people have been informed it's going to be starting today. But at what level are you in terms of preparing or getting ready for the hospital to start accommodating patients of COVID-19?
Yeah, that's what I'm saying. It's not that we've run out of space. It's not that we don't have space to handle this thing. So we have to do it very well. That's what we are working on. So right now we have other places that are not even used, like the fourth phase Memban is not still used, and that's a lot of beds there. So, but we need to do continuously. We don't need to wait until everything happens, then we start working on it. But you start planning well before so that it's done very well, and when the need arises, it will not affect the patients, because you have to do it in a seamless transition. There shouldn't be any problem with the patients who don't have COVID, who are coming there. The staff should all run nicely in a treatment center. So all those things have to be put in place, and those ones are operational issues.
Tell us, what is the state of the other patients that were at the hospital? Are they all transferred now to other hospitals?
So that's what I'm saying. The transition has to be smooth. And before we start using that place, all those things have to be dealt with nicely. And everyone has their place they go. And everybody else who refers to Kanifing knows where he's referring now. And other facilities that need to be taken up to a higher level, that too also done. so that the burden on Bundung and Banjul will go down. So all these things have been looked at, and it will be done. But the process has started. It's not like we are rushing.
Finally, when we get to the time and, eventually everything is completed and the hospital is changed to a COVID-19 treatment center, I mean, does it mean then no other person will be allowed or accepted to go for treatment at the hospital apart from COVID-19 patients?
Yeah, so we will communicate that to the public when the time comes. But there are two options. One is that it could be a totally COVID-19, but it could also be dealing with suspected cases, like I'll have an isolation part